Today's presentation is on intellectual disabilities and autism and spectrum disorders. This won't be as long as the others because Days of Our Lives is on, and I have to see what happens at the end. I'm kidding. There's just not as much material in this chapter, so we'll walk through it, and hopefully you'll learn something about these different disorders. Now, there have been a number of changes between the DSM-4 and DSM-5 that I'd like to address first. That begins with how they've changed the definition of autism. Used to be that there were all these disorders over here on the left that you can see. There were separate disorders for DSM-4. Now they've changed it to consider them all one part of the broader spectrum of autism. And so it's considered a spectrum of disorders that varies quite a bit in terms of the intensity of disability and also the types of symptoms you see. I think about the chapter that we recently talked about in terms of schizophrenia and the different courses and how I mentioned that was kind of like a family of disorders. This is a very similar model here, where we have a spectrum of all sorts of things that used to be separate individual disorders, now captured under one umbrella. Social communication disorder is a new disorder in DSM-5. If you look further, they've changed the name from mental retardation, which used to be the name for very low IQ and things we'll talk about. We'll talk a lot about intellectual disability here in just a minute, to which I think is a much more humane name, intellectual disability. Reading disorders now dyslexia, math disorders dyscalculia, sounds like Dracula or something. And let's see, those are the big ones I really want to highlight for you to take a look at. In the DSM-5, I've basically listed here all the disorders that they go through, starting with intellectual disability, which we're turned to first, then communication disorders, then autism spectrum disorders. When we go to the next chapter on disorders of childhood, we'll get into things like attention deficit and hyperactivity disorder and specific learning disorders with math and reading and written expression, some motor disorders. There are some symptoms of autism that overlap with these. So the DSM-5 incorporating these all into one chapter called neurodevelopmental disorders made some sense to me logically. So the overall criteria for being diagnosed with intellectual disability or mental retardation, as DSM-4 calls it, is having significantly sub-average IQ of approximately 70 or below. The average IQ for the average person in the world is about 100. So that's roughly two standard deviations below that mean of 100. Also, you must have deficits in adaptive behavior. That means like in living skills or in job skills, in school, and that the onset of the sorts of symptoms we'll be talking about occurs before the age of 18. Keep in mind that defining IQ has been has quite a bit of controversy surrounding it. And a lot of people have accused it of not being culturally fair. I know when I was trained on how to give the IQ tests, it was clear to me that a lot of the questions that had to do with like trivia and things like that were very white culture, mid-1950s, 1960s bound. And it did not make sense to have that be like your standard measure of IQ. But there were some other tests which within it, because there are a multitude of different tests within the IQ test, like trying to create formations based on a pattern that you see and putting a story in a sequence of orders given the pictures. Some of those make more sense to me. And I think that's where an IQ test can really be more helpful, is if you're looking at the extreme end, especially the low end. If you have a person who can't look at a series, like I'm thinking of a cartoon sequence, like you might see in the Sunday comics or something like that. And typically you can look at that and put together, here's one panel, it's a storyboard, here's another panel, here's another, and you put those together in order and sequence because there's a logical sense to it. Someone with a low IQ would have a very difficult time doing that. And that's something that those tests can pick up. So there are still some validity to portions of that test that can really help to determine whether someone might have an intellectual disability and then need services. So I don't want to throw the baby out with the bathwater when it comes to that. Also, in terms of intellectual disability, we have different degrees. We have mild, moderate, and severe. So mild is between 50 and about 70 IQ. About 85% of the people who are diagnosed with intellectual disabilities fall into that category. You have a few physical problems here. Can usually read about the 6th grade level of reading and math, can learn job skills, and now most frequently, folks diagnosed with mild and ID are live in a community, live at home with family members or in a group home, or they're active and have full lives. Moderate ID intellectual disability usually has an IQ of about 35 to 50. It constitutes about 10% of people diagnosed with ID. And they can typically achieve about a 2nd grade level of reading and math and knowledge. If they work in a job, it usually requires pretty close supervision. Excuse me. I know that Easter Seals in Jefferson City, and there's another agency, Cole County. There was a agency that worked with. It was basically a set of group homes for people with intellectual disabilities, and they had the people living in apartments, supervision in the apartment buildings. Cole County Residential Services Inc. And I had a number of interns work there back in the day. And then the residents would go work at like Easter Seals or someplace like that and have a job, and then get paid, get money, but be closely supervised with this. Group homes are common in the moderate condition. In a severe condition, excuse me, you have about IQ about 20 to 35, and that's about 3 to 4%. This usually has a lot of motor problems, so physical motor problems, coordinating movements, even be able to get your hand to grasp exactly where you want it to. And communication problems is difficult, may not have any ability with language and requires consistent supervision. And then profound is below 20. That's about 1 to 2% of the population. I have a friend who has a son that falls into the profound intellectual disability. And I have to give my friend credit. He's very patient, and he co-raises his son with his ex-wife. And it does require a lot because of, well, and you'll see when we get into some of the other symptoms of the things that he might try to eat, and that may cause poisoning, and it takes a lot of supervision that way just to make sure there's no accidental harm that happens. If you look at the biological factors related to intellectual disability, there's all sorts of different conditions we can look at. You're probably familiar with Down syndrome. I put this person's picture up because it shows you some of the physical features that might go along with the face, including the kind of the more eyes that are kind of slanted. This person doesn't have a protruding tongue, but usually much shorter than the average person. And so the reason that a person could be born with Down syndrome is that they have an extra chromosome in their 21st pair of chromosomes. And so this just causes physical problems and intellectual disability problems. Typically, what you see is physical and speech deficits. So not communicating very well with language. Usually people with Down syndrome are pretty social. I have another friend with a son who has Downs, and very, very social and likes to be around people, likes to just engage, and yeah, actually your book talks about that quite a bit. And they say that some have even argued that that's one of the features of Down syndrome, and they haven't found evidence to support that, but it is certainly not uncommon. Fortunately, the way folks with Downs are treated, and the way that they're really, well, the way that the U.S. Deals with this now is not institutionalization, which used to happen so frequently. It's more like community living, group homes, living with families, and again, being part of a community. One odd aspect of this that I found out probably a couple years ago, um, and I knew they didn't live, persons with this who were diagnosed did not live very long lives, so usually mid 30s or 40s. Um, it's because the chromosome problem also creates organ problems, and sometimes they have organ failure. Um, and also, it tends to lead to symptoms like Alzheimer's. And I'm not clear exactly if that is actually tangles in the neurons that you see in Alzheimer's, um, or if the plaque. There's another problem that happens with Alzheimer's, but you can see a dementia that happens much earlier for folks who have been diagnosed with Down syndrome. PKU is another biological kind of factor that can relate to intellectual disabilities. Um, and this is a recessive gene pairing. So you have one recessive gene from one parent, one from another, the pair. And what that leads to is the child that's born, their body does not produce an enzyme that breaks down certain amino acids. And so if they eat certain things, I believe like fish and dairy and things like that, that the metabolized amino acids can cause buildup of those damaging amino acids in the brain and lead to all sorts of intellectual disability problems. Fortunately, this is a disorder that can be screened for at birth. And then diet is used to treat it. So you avoid anything that has the type of amino acids that they lack the enzyme to break down. So, and most states require screening so that it can be controlled by diet. Other biological factors include a breaking of one of the X chromosomes. You get learning disabilities that go along with facial features that include like a long face and a large jaw. And then fetal alcohol syndrome, I mean, so what I have here for this picture is that you look at about 1 or 2 of every 1,000 births. And when you break it down, that's actually quite a bit. You'll have the child being born with fetal alcohol syndrome. Typically, what you see is a flattened features of the face, kind of a wider face too, and all sorts of intellectual disabilities. If a mom who, while she's pregnant, drinks at least 5 ounces of alcohol a day, now 5 ounces, that's quite a bit. That's like 5 shots. They're twice as likely to have a baby with fetal alcohol syndrome in comparison to a woman who drinks 1 ounce a day. Actually, the Food and Drug Administration and I think the Surgeon General basically say don't drink if you're pregnant, and don't smoke cigarettes, because that also contributes to developmental issues for developing fetus. You see learning disabilities in kids with FAS. Also with FAS, I've shown a video in my introductory psychology class where children are given tests where like basically you present a square and they're supposed to replicate it. And there's just impossible to replicate. Basically a square will look almost like a triangle. And then some of the inhibition, a lot of the brain is just devoted to inhibition, like stopping us from doing things. And this one case that I show in my class has a kid with FAS trying to draw a face of a human being, but because there's a lack of this kind of stop doing that, they keep drawing the nose over and over and over and over and over and over and over. And it's like we have to have our brains, our neurons coordinated so we can initiate a project and stop a project. And with fetal alcohol syndrome, those things are disrupted. Other factors that are biological, actually, and psychological and social. For biological, we have toxins, and that can include weed, nicotine, even prescription medications. Also lead and mercury. If you're thinking about getting pregnant, please consult a doctor, or if you're part of a couple that's thinking about getting pregnant, just be aware of which medications could create problems for developing fetus. Also, Rh is a protein on the red blood cells. And if like the mom and dad have, one's dominant and one's recessive, and the mom's recessive, and then she's giving birth to a child that is Rh positive, once her blood is exposed to the Rh positive protein in the red blood cells, her body will start to create antibodies to that Rh positive. So future kids could really be a danger of basically being attacked by the womb itself So there is a injection they give to women when they realize there's an incompatibility of Rh factor called ROGAM, and that could prevent that sort of attack happening to future fetuses. HIV can be passed along to a child that's being born. Also as herpes, actually, if a woman is having a herpes outbreak during birth, they'll typically do a cesarean section to prevent the child from being exposed to that in the birth canal. And rubella, which is something you can easily get a vaccination against. So that's a preventative thing that can happen. For psychological factors leading to intellectual disabilities, typically, I mean, without biological factors, just having psychological factors, it's not very common. It's extreme neglect and or torturous abuse. There's a case described in your book. There was an evil dictator in Romania that basically, because of their terror kind of reign, just led to the formation of all these orphanages where Romanian babies were not being tended to, and so there's a lot of neglect there. And then that led to some intellectual disabilities in those cases. It was a horrible situation during the Balkan Wars in the late 90s. Some social factors that can contribute to intellectual disabilities include extreme poverty, which is related to all sorts of things, including how much stimulation a child gets as they're growing up, because kids need a lot of question and answer, back and forth engagement, like say something, respond, go back and forth, imitation. If you have both parents or there's a single parent and they're working 2 or 3 jobs, there's just not a whole lot of time for stimulation. Also, with extreme poverty, there may not be the nutrition for the brain to be able to get the vitamins and nutrients it needs to develop. And just environmental risks, like some housing that has not been brought up to code. Old lead paint can be chipping away in windowsills. And a lot of times kids just put things in their mouth, and so you can have exposure to lead poison in situations like that. Ways to try to prevent intellectual disabilities includes primary prevention. That means planning for pregnancy if at all possible. I think that's probably the best solution. Getting vaccinated for, again, rubella, measles, things like that. Substance use prevention, so that you don't have a mother abusing substances while she's pregnant. Your book also talks about doing like a test of the developing fetus by sticking a needle in utero to draw out some of the blood cells, and then trying to get a test of the chromosomes of the developing fetus, so that then a parent can make an informed decision about whether or not they want to have an abortion. That is obviously very controversial. There's a whole section in your book devoted to eugenics, which is basically, it was a program of sterilization of people with intellectual disabilities in this country up in the 1970s in some states. It was basically the major plan used by Hitler, a way of genocide, basically just wiping out whole sections of the population. Read about it, please. I mean, the fact that they listed this as a possibility for primary prevention shocked me. Secondary prevention includes educational interventions like Head Start. And that's probably been the most successful secondary prevention of all, which includes nutrition and plus doing education too. That usually results in an increase in IQ of about 5 to 10 points and increased high school graduation rates. So early, my partner works in early childhood education, getting grants and collecting data to try to figure out what works for kids. Has convinced me that, excuse me, that even though we need more funding for higher education, that early childhood education dramatically needs to be funded, because this is where the most difference can be made in the intellectual functioning of children. All kids deserve a stimulating and also well-grounded with nutrition kind of beginning, so that they can take in their environment, learn from it, understand social interactions and the information that's coming to them. They're being bombarded with information all the time. So having an early ability to grasp all that information is critical. Tertiary, what they call kind of like third level prevention, is more like treatment to me. And that's screening for PKU, which we just talked about, having the children be able to learn self-care, but also parents who have kids with intellectual disabilities, having them be parts of groups where they get support from others. I have a friend who has twin girls, who probably moderately intellectually disabled along with autism. And finding a group of other parents has been just unbelievably helpful for her in understanding that she's not alone, and that she can get support and understanding and empathy from other people who are in a similar boat. Also, we'll talk about meds and life skills training a little later. Finally, in terms of society, normalization includes like mainstreaming kids. Back in my day, when I went to elementary school, any child with intellectual disability was automatically put in special ed, and they were not included in classrooms with kids who do not have that. What we found through the research is that kids with intellectual disabilities benefit greatly from being mainstreamed into classes with kids that don't have ID. And so you want them to be able to flourish, and also can help kids who don't have ID have some empathy and understanding of the diversity of the population and the world in which we live. Deinstitutionalization is just what it sounds like. Instead of putting kids with intellectual disabilities in orphanages, or just sticking away in psych units in hospitals, having them be part of communities, and even like group homes that have engagement in the community, that have social interactions, that have a lot of family involvement. And so it's not just a sterile environment, more like a hospital. So stopping that and having people be part of the community has been really helpful. I want to switch gears and then focus exclusively on autism spectrum disorder and autism itself. Not really going to say anything about Asperger's. Excuse me. This lists a number of the symptoms I'm going to go through individually, but I thought I'd give you a heads up. This will be on Canvas. But we're looking at developmental delays of greater than 3 years of age, along with impairments in social interactions. And we'll talk about some of this. Communication with other people. Patterns of behavior that either are restricted or very repetitive or stereotype for them. We'll kind of get into that as we walk through this, but I just want to give you a brief version of the criteria, excuse me, for autism in the DSM-4. So the onset of autism is early. There's no physical features of the face or anything like that can help distinguish a child who's been born with autism. But frequently what you see is that a child won't respond. They won't, typically if you hold an infant or a toddler, they will conform their body to fit yours. And so they can get comfort, and that it's kind of a molding together and bonding and attachment between a parent or a caregiver and a child. You frequently don't see this as often with kids who have autism. They may even as infants and kids may be stiff and not conform to the body when they're being held. You call their name, not recognize or respond as if you said their name. And a lot of times, you could, when you're dealing with a toddler, you could pick up the phone and say, hey, looky here, what we got here. Basically you and the child will be looking at the phone. That doesn't happen. And when the child has autism, it's just it doesn't follow those sorts of social cues. And so social deficits are pretty big, and that's usually what starts to set apart a child who has autism. One study of 1-year-olds I know, it's like, I need to study 1-year-olds. They had birthday parties and they filmed all these birthday parties. And they had independent judges who had no idea about the autism thing say, hey, see what you can notice about the different kids at this party. And consistently, I mean, we had a study like this we talked about with schizophrenia in terms of movement problems, but with autism, you saw the kids who, again, the judges didn't know they had autism, but said that child there doesn't seem to be moving their hands and gesturing like the other kids do when they want something, and they don't look at the others as much. And so those were factors that can help a parent notice that their child might be dealing with autism. Um, so, excuse me, failure to speak between 1 or 2 years of age, or sometimes kids with autism learn some of the words and then they lose that language. All sorts of speech problems, which include this thing called dysprosody, where it's more like I should have got an example of this, where you can tell as I'm talking, there's a rhythm to it. My rate hopefully changes here and there. I emphasize things by saying them a little louder or maybe even softer, slowly, rarely. And you see these things being odd, unusual, those sorts of the rhythm, rate, and intonation changes more randomly than with the meaning of what the child's trying to express. Also, echolalia is just repeating the same word over and over, or maybe even repeating the word that you just said. The pronoun reversal, I mean, read about pronoun reversal in your book because I find that fascinating. Just really not understanding what pronouns are about. So calling you, I, or me, obviously that's not right. And most kids readily imitate what a parent will do. Like even trying to train your kid to tie their shoes, you do it and they do it. That's not really possible. Typically, I mean, it's really interfered with kids with autism. Not every single kid, I don't want to overgeneralize because autism is a broad spectrum now, but that is a frequent problem you see in that disorder. Also, any abstract idea, it can be a challenge sometimes. There's a quote in your textbook from a famous person with autism by the name of Temple Grandin that I encourage you to read. Claire Danes portrayed her in a movie that was on HBO, did a really good job of portraying what it was like to move through the world with autism, and based on writing that Temple Grandin did. It's actually a powerful movie that I recommend that you see. Temple Grandin felt like she had a unique sort of insight into the treatment of animals and was able to design more stress-free ways to handle cattle as they're being processed for death and food in slaughterhouses so that they wouldn't be so terrorized and terrified. But because of the way she saw things, was able to design something like that. Some more symptoms of autism spectrum disorder is social interactions are clearly impaired. I mentioned that they're not folding to the parents holding. So almost no interest in attachment, not seeking comfort or friends even. Avoiding eye contact. I'll show you here that on the right, you can see that a child without autism will typically look first at left eye or right eye, left eye, and then kind of mouth, nose, and you can just see how that works. It's like, it's consistent. Child with autism almost appears to avoid that. It's like, oh, we're gonna look at nose, and then, oh, eyebrow, let's look at cheek, now let's look at lips, let's look at nose, cheek, chin, forehead, avoiding eye contact. And so that's just kind of a telltale sign. Your book talks about the lack of a theory of mind that may make it difficult for kids with autism to empathize with others. And if you've had general psychology, you'll remember hearing about Piaget and his stages of intellectual development. And the theory of mind is basically the notion that when a kid reaches a certain age, they realize that you as an adult don't know everything they know, and that they don't know everything you know. But before that stage, they don't get that. One of my favorite examples is from a movie that I used to show in class. I was looking for a package. I don't have one, but this kid is given a package of M&Ms, and he's all excited. He opens it up, and they put pencils, little golf pencils in there instead. And he's like, and because he thought there were going to be M&Ms in there. And then they like seal it back up. He said, "Hey, your dad's been in another room. He has no idea what's going on here. We're going to have him come in and give him this bag of M&Ms. What do you think he's going to think they're in there?" He's like, "He's going to think there's pencils in there." Because the kid has not reached a developmental stage where he realizes that his dad doesn't know everything he knows. And that's what theory of mind is. I have my own mind, you have your mind. And so the idea that you have a separate mind who doesn't know everything. And so it's thought that perhaps people with ASD are not as kind of fluent with that idea, I guess, than kids without ASD. You get repetitive behaviors, so the hand flapping that kind of goes like that sometimes. There's a story in your book about a string play, and the question that your author says, like, okay, is that to increase sensory stimulation because their nervous systems don't have enough, so they're trying to, a kid with ASD is trying to increase their own nervous system stimulation, and it's basically come to the conclusion from the authors, and it makes more sense to me, that they're trying to make the stimulation they have very predictable and consistent. And so it actually decreases the overall amount of stimulation coming into their system. And that would make some sense because from what I understand with down here, when like apparent sensory deficits, kids like with Asperger's and ASD generally can be really sensitive to sensory overload. With loud noises, cold temperatures, or hot temperatures, being completely overwhelmed. And that kind of goes along with almost having too much sensory input to make sense of. Now, I'm not saying there's nothing wrong with ears or eyes or nose or mouth or anything like that. It's more about the overall brain processing that input. Kids with ASD sometimes injure themselves, sometimes beating their heads against the wall. There is controversial treatments for that using shock devices. Actually, I used to show a video in class where kids were shocked who were self-injurious. Obviously, ethical issues. The parents were for it. I mean, it's a short, strong enough shock to have the child stop like smashing their head against the wall. They interviewed one of the kids. He said, "Well, I don't hurt myself anymore. I think it's better." But there are people protesting the fact that they were using this kind of treatment in a school. It's like, well, it's either a short time of shock or lifelong brain injury because of head beating. Obviously controversial. And there's some notion that is thought, like through Rain Man and things like that, that sometimes people with ASD were just geniuses, but it was being masked by these other symptoms. That doesn't appear to be the case. It's just that they may have some special skills and observational skills that may elude other people. And so see the picture of the horse that's discussed in your textbook about that. Okay, so for like the last slide's presentation was a little longer than I thought. We have the frequency of diagnosis of ASD has dramatically increased in the past few decades, 25 times the number it used to be. And a lot of parents want to argue it's due to vaccination. There is no evidence at all at this point that's related to any vaccinations, to be clear. And you have to go by research because this is a scientific class. No evidence at all to support that notion. There is evidence to support these other ideas, that there may be some other strange new environmental agent that might be contributing to this increase. So even like bisphenol A and the endocrine disruptors that can be found in some plastics and that then leach into the foods and water that we drink, that perhaps maybe exposure to that might lead to or be related to some of these disorders that we see, like ASD, possibly. Hasn't been researched enough. Also, the criteria the psychologists use to diagnose ASD has been expanded, obviously. So I said it was an umbrella of different conditions now. Parents are now much more aware of it. Some argued that, wow, it seems that kids with autism often have highly educated parents. Well, it's like, actually, highly educated parents are usually aware of the symptoms and they take their kids in for treatment and diagnosis more frequently. So it's kind of a illusory correlation there. Also, better assessment tools have been developed for psychologists and psychiatrists. And so that has helped us diagnose more accurately than before. Treatments, about 20% of kids with ASD go on to live somewhat normal lives with independent living. Treatments, excuse me, can include SSRIs for like OCD type symptoms, some of the repetitive type behaviors. I had one intern working in ABA therapy, which I'll mention next, where the child was just like completely fixated on eggs and would take the eggs out of the refrigerator and go put them on the couch one at a time. So trying to disrupt those compulsive behaviors. Risperidone's an antipsychotic, but it can be given to help behavioral management. Most parents' kids don't like this because it leads to lethargy and weight gain, and most kids don't even like that. And there's applied behavioral analysis, which your book goes on for about over a page, describing just the kind of level of patience and attention, the meticulous attention that has to be given to repeating certain things over and over to have a child with ASD understand about how social interactions can work to be more productive. I encourage you to read about that treatment because it's one of the best ones we have that could be therapeutic with kids with ASD and can be used and implemented early in a child's life. That is all I have for this presentation. It turned out longer than I thought. As always, hope you learned something.